But we begin with the first day Tulsa hasn't had a mask ordinance in almost a year. City leaders let that mandate expire at midnight this morning, lifting other restrictions as well. Tulsans no longer have to wear a mask in a lot of public places, but it doesn't mean you don't need to grab one before you leave the house, because businesses can still require that you wear one, and they are still mandatory if you ride the city bus or in city buildings. Mixed group on Cherry Street this afternoon. Some people were going without the mask. Others kept the mask on even when outside.
I think that the masks are still helping. We're in this in-between space where kind of letting down our guard will actually make this go longer. So it does help. It's helpful, especially when we're dealing with restaurant and servers, people that are dealing with our food, and even shopping where we're in close quarters.
Other cities in Green Country, including Muskogee and Jenks, have also let their mask mandates expire. Tulsa City leaders say we've made it halfway to herd immunity in Tulsa County, and hospitalizations are low enough that they felt comfortable dropping the mandate. There is no question COVID has taken a terrible toll on Oklahomans. It is blamed for more than 8,000 deaths. NewsChannel 8's Jamison Keefover spoke to one woman who used her loss to help others hopefully avoid that same hurt. Jamison.
That's right, Aaron. Jody Keefover has a story of sadness turned into hope after her grandmother passed away from COVID-19 alone in a long-term care facility. She used her work with CVS Health to help other Oklahoma families. Jody Keefover adored her Nana. She was someone she and her sister could always turn to.
We spent every afternoon at her house. She was a big part of who we are and who I was to become. So losing her to COVID really impacted me.
She was in a long-term care facility in Oklahoma when the pandemic hit.
My mother got to see her on Mother's Day, and they wheeled her out to the front door, and she got to see her from 6 to 10 feet, and she couldn't touch her or give her a hug. All they could do was kind of wave from a distance, and that was the last time she saw anyone, because 4 days later she passed away alone in an isolated room because of COVID precautions. No one got to say goodbye. No one got to be there with her, hold her hand. Something so momentous as your grandmother, or for my mom, her parent passing away, no one was there to be with her.
Jody took this heartbreak and put it into her work as a pharmacist, becoming one of the 2 CVS leaders in Oklahoma to get the vaccine into long-term care facilities.
It was still very exciting that we got to go in and bring these vials of hope. I felt excited that I got to be a part of the change.
CVS helped vaccinate almost 22,000 staff members and residents at 176 facilities in Oklahoma. Jody was called to the effort because of her Nana and for other Oklahomans.
So I can help make it to where you can say goodbye to your grandmother, or you can give them a hug, or maybe they can recover from COVID and live longer. Then that was the reason why I did it.
She has moved to giving shots daily inside her CVS store, helping anyone get a shot that wants one.
I would encourage the younger people to definitely still get the vaccine, because you can protect your grandmother or your aunt or anyone who's older.
State officials say vaccinations are down in the state, especially with younger Oklahomans. Jody says this is an opportunity that anyone can take advantage of so they can help save lives. Live in Midtown Tulsa, Jamison Keefover, News Channel 8.